Hi, I'm Whitney Witt, the Dean of the College of Health at Lehigh University, and I want to welcome you to our webinar series, Population Health Weekly, where you, the students, get to learn more about this exciting and burgeoning new field of science. And today we're going to be talking about population health careers, which is very, very exciting. There are lots of opportunities, and we'll discuss lots of different sectors that are looking for graduates from our 2024 inaugural class. So welcome to the webinar. I am accompanied by my esteemed colleagues, Dr. Hal Skinner, who's the Associate Dean for Research and an Associate Professor, Dr. Ed Gomez, who's an Associate Professor, Dr. Hyunok Choi, who's also an Associate Professor, and finally, Dr. Fathima Wakeel, who is an Associate Professor in the College of Health. So welcome to today's webinar. Next slide, please. So one of the things I wanted to start off with is talking about what makes Lehigh's College of Health different. It is the first institution in the world to offer an undergraduate degree in population health with a focus on health innovation and technology. And through our groundbreaking curriculum, experiential learning programs, and immersion in Lehigh's highly interdisciplinary academic culture, our students are challenged to learn and grow in the classroom and apply their knowledge in the real world. And so when your time comes to an end at Lehigh, you're going to be prepared to improve the lives of millions of people at a time. Next slide, please. So here I wanted to show that the College of Health is very much in line with what makes Lehigh University very distinct. Lehigh is unique in that it has many interdisciplinary programs. It also is very focused on experiential learning and really getting students involved in real-world focused research under the supportive guidance of faculty and in working with external partners. Lehigh is also known for entrepreneurship. So really thinking about how can we get students and faculty to become successful innovators, think about opportunities and develop creative solutions for the marketplace. And then finally, with creative inquiry, this is one of the defining principles that Lehigh promotes and offers a variety of different opportunities for the College of Health students and faculty to pursue new intellectual, creative, and artistic ways to come up with new innovations and new questions and hypotheses. So the College of Health sits in the middle of all of this, and we'll be able to take advantage of all of these exciting opportunities at Lehigh University. Next slide, please. So the launch of the College of Health comes at an exciting time in health and healthcare, one during which leaders in healthcare, academia, government, and industry are all thinking more broadly about the concept of health. The demand for professionals with expertise in population health and data science is growing at a pace that really exceeds the supply of graduates. And in fact, an IBM report shows that jobs related to clinical data analysis increased by 54%, with the need for clinical data system specialists expected to increase by 24% this year. In 2018, the National Institutes of Health in their strategic plan specifically called for efforts to enhance the nation's biomedical data science research workforce. And so they're really trying to create training programs and opportunities for people to grow into this new area. So the College of Health will lead the pipeline of talent with undergraduate education in population health data science. Next slide, please. So here I wanted to underscore that we are seeing it, we're seeing it not only from the NIH and some of these studies, but there's a growing demand for data scientists, even from healthcare providers and payers. And in fact, in 2019, the United Health Group made a 5-year, $2.5 million investment to help train data science analysts at 4 historically Black colleges and universities. And this, they actually estimate that job openings for data experts in the United States will exceed more than 2.7 million in 2020. Next slide, please. Here I wanted to show you some data that was published in 2017 about making the case for the need for data scientists in healthcare. This was published in the New England Journal of Medicine's Catalyst publication, and they talked about how 30% of the world's stored data actually comes from the healthcare industry. And of the data scientists in the United States, the 6,000 data scientists that are sort of card-carrying data scientists, only 180 of them work in healthcare. So healthcare could use between 10 to 20 times more data scientists. So there's really a growing need for data science in health. Next slide, please. Here I wanted to show you that as we are thinking about the field, there are a number of startups that are really transforming healthcare with artificial intelligence, and also in terms of in developing tools, but also in the methods that are being used for analysis. Machine learning, natural language processing, and many of these startups are using those kinds of methods and are looking for graduates to be able to come in and with those skill sets. Next slide, please. So this is from a report that was put out by the World Economic Forum, and they examined emerging needs for the workforce in global health and healthcare. And here what I wanted to show you were what are some of the emerging roles that we are seeing across the globe. And what you can see here on the left-hand side of the slide is that the emerging roles are really for data analysts and scientists, biologists and geneticists, artificial intelligence and machine learning specialists, and so on and so forth. And this is expected to increase. It was 8% in 2018. It's expected to go up to 17% in 2022. So we're seeing just a growing demand worldwide for students with these skill sets. Next slide, please. So one of the things that I think is so exciting about Lehigh and the College of Health are the experiential learning opportunities. You all are going to have the opportunity to work right alongside the faculty doing their research. You're going to have the opportunity to be involved in internships and field experiences and even international experiences if you wish. Next slide, please. So one of the things that we are doing is we are building partnerships with a number of community-based organizations, health networks, other academic institutions, and private sector business and industry. And I wanted to mention this because I think there are a lot of opportunities for student internships as a result of this. So not only will our students be working right alongside our faculty in conducting research, there will also be opportunities for students to go outside of Lehigh University and with our support and work alongside people who are working in health networks, people who are working in in tech companies with big data, people working in the community trying to improve population health. So there will be lots of opportunities for students to get practical experience. Next slide, please. So here I wanted to just show that not only are we focusing on partnerships and opportunities for you all here in the United States, but we already have a very significant global footprint. We have developing partnerships, they're in green, those are the green stars, and then established partnerships are the red stars. So we can see that we already have a lot of really wonderful opportunities for our students to go out and have an experience in global population health. Next slide, please. So what can you do with your degree? I'm sure that's one of the biggest things on your mind, and I would love to tell you more about that. Next slide, please. So there are really 4 career paths in population health, and those include the private sector, the nonprofit sector, academia, and government. In the private sector, what we're really talking about are consulting firms, health technology, big data firms, and certainly pharmaceutical companies. In the nonprofit world, there are opportunities in professional societies like the American Heart Association, the March of Dimes. Many of these disease-oriented or focused organizations have a lot of data that has not been linked to some of the social and environmental determinants of health, and are looking for data analysts to come in and be able to help them with that. So there's a real opportunity in the nonprofit sector. In academia, certainly people may want to go on and get a graduate degree in population health, or they may want to further their career in going and getting a medical degree, which is certainly a possibility. You know, and we have made that available for our students should they decide to take that path. And then finally, there will be opportunities for you in the government. So at the local, state, federal, and international levels. Governments collect data all the time, health-related data, and often are not looking at some of the other factors that might be contributing to health outcomes. And so they really need data scientists in health to help them bring all of that information together. So you may have some really wonderful opportunities in government as well. Okay, so one of the things that we've done is we've done some sleuthing to find out a little bit more about who are the employers, you know, who are hiring out there in population health. So among the private employers advertising, and this is on Indeed.com, you can see that there are hospitals and health networks who are hiring. There are health technology firms, and I won't go through them all, but you can see them there. Next slide, please. There are also, among the private employers advertising for population health related jobs, consulting organizations. So Booz Allen, Accenture, Apt Associates, IQVIA, and some of the other ones there you can see are all organizations that have big government contracts that do a lot of data analysis in health and are always in need of data scientists. So, so they're definitely employers. So what kinds of job titles might you expect to look for? So when we went and looked on Indeed.com and based on some of our own expertise, having worked in the field, some of the typical titles are population health data scientist, population health researcher, industry consultant, global health specialist, bioinformatics or informatician, health program specialist, project analyst, population health systems integrator, epidemiologist or biostatistician, or research analyst. Next slide, please. So as I mentioned before, there are a number of nonprofit employers that have been advertising for population health scientists, and those include the American Hospital Association, like I said, the American Heart Association, American Diabetes Association, and a number of other organizations there. Next slide, please. And here, the typical job titles that we see are community health director, program coordinator, project manager, engagement specialist, health educator, or grants manager. And then finally, in the government employment field, we see a number of different titles like health educator, grants manager, policy scientist, population health policy analyst. And the agencies who are hiring for these jobs are the National Institutes of Health, the Centers for Disease Control and Prevention, state health departments, county health departments, and even the Peace Corps. They're all hiring, and I would also extend it to international agencies as well, like the World Health Organization, the Pan American Health Organization, or PAHO, also are included in those among those agencies. So I am going to stop there. I know that was a lot of information, and I'm going to turn to Dr. Wakeel, who's been monitoring our chat box to see what questions we have. Dr. Wakeel?
Hi everyone. So I think we can start with the first question. I think I'd be asking each of our faculty members how we each got into this field of population health. So can we start with you, Dean Witt?
Sure. Okay, so if we go back to the slides, we can, there's just a picture with a quote, but I'll talk a little bit about how I got into this field. Okay, there we go. So I got into this field in a very haphazard way. I was actually headed to law school. I was working for the Gay Men's Health Crisis in New York City as a legal advocate for people with HIV and AIDS, and became very interested in health policy and sort of how is it that my clients are ending up on the verge of homelessness. So I started looking into health policy programs to get a graduate degree, and ended up going into public health and then into population health. So that's how my career began at the beginning of another pandemic. So I will now turn it over to Dr. Skinner, who can tell us about how he got into the career of population health.
Great, thanks very much. My path was sort of meandering, and that seems to be common for a lot of folks who end up in population health. I was an environmental science major as an undergrad, and I thought I was going to be Jacques Cousteau and examine coral reefs and swim with dolphins, but there was a hurricane and it was a big mess. So I ended up switching into an interest in human health. Was working as an emergency medical technician in Miami, and really got interested in some of the underlying questions of why people were ill, and ended up pursuing a master's degree in epidemiology, and went on then for a PhD in epidemiology at Johns Hopkins, and got really invested in understanding the molecular and genetic mechanisms underlying risk and progression of cancer. That has sort of brought me across a wide range of projects and experiences to where I am now, and really happy to be here at the College of Health, which is going to be doing something, again, hasn't been seen elsewhere. So I look forward to meeting all of you and in your journey.
Great. Thank you, Dr. Skinner. So now let's hear from Dr. Wakeel.
All right, so as Dr. Skinner kind of mentioned, my path was a little bit meandering as well. I was pre-med once upon a time. I actually majored in chemistry as an undergraduate student, but I was always interested in maternal and child health ever since I was in high school. And I think that started when I witnessed the birth of a child as part of an internship during high school. So I knew that was the path I wanted to take because I learned very early on that, from that experience, I felt like health is really shaped from the very beginning of life or even before life. So, and then if we can intervene at that level, we can really make a huge difference in a person's entire life course. So that's really what my research focuses on these days. So that's really how I got into the field, and I found my way to public health and population health throughout in my journey.
Wonderful. Thank you so much. And now I'm very pleased to turn to Dr. Choi, who will tell us about her path to population health.
Thank you, Dr. Dean Witt. Well, just like many of our colleagues, I mean, I too have to say that I fell in love with the field. I mean, I can't describe it in any other terms. So, I mean, in between graduate school, I thought I worked very briefly as a data analyst in the faculty of medicine at Einstein. And I had this opportunity to present my data, and I was asked during the presentation this extremely compelling and unfair question as to why I was seeing such a huge disparity in birth outcome across the different ethnic and racial groups. And something about that question just hooked me. And I kind of intuited that I was working on something extremely important and fascinating, and just got excited about following this, I don't know, this journey.
Yeah, very inspiring. Thank you so much. And now we'll turn to Dr. Gomez.
Great, thank you, Dean Witt, and thank you everyone for taking the time. I got interested in population health in graduate school when I was studying political science. And I always tell my students, I always never know, you may change your views and ideas and interests. And so through a course that you take. And so in graduate school, I took a course on social policy and democracy. And I started doing research on decentralization in Brazil and healthcare. And I started to realize how interesting the decentralization process was and how that impacted healthcare issues. And so I started to write a lot and do research on it. And at the same time, someone at the Harvard School of Public Health had contacted me while I was at Brown and had read one of my articles on decentralization and had invited me for my final part of my PhD to be in their politics and governance group at the Harvard School of Public Health. And I went there not knowing anything about public health. And so I was there as a political scientist, and I was working with someone working on decentralization. And then I realized, well, there's not much written on political science in global health. And so I got very intrigued and started working with colleagues there, and ended up changing my whole PhD dissertation and did a dissertation on the US and Brazil in response to AIDS and obesity, and looking at politics and society all through a political science lens. So it was very unexpected, but I've loved every minute of it. I felt that this is a wonderful field and an alternative approach to looking at population health, and has led to a lot of interesting new insights and research that has emerged in recent years through applications of political science and global public health. So that's how I got interested in it. So.
Wow. So inspiring. And one of the things that I just want to reflect on is that as you've heard from all of us, we all kind of fell into this field, and you all as students are very fortunate. You're the inaugural class of 2024. You're not going to fall into the field. We are going to mentor you and challenge you, and you're going to challenge us, and we're going to learn from you and teach you about this exciting new field of science. So you have the opportunity to start fresh from the very beginning and with intention. So I couldn't be more excited for you. Okay, Fatima, do we have another question from?
We do.
Okay, great.
We do have some great questions from our students, very exciting. So I'm going to direct this to Dr. Skinner with his expertise in epidemiology. As a population health scientist, when do you think students will be able to return to Lehigh, in your personal opinion?
Wow, that's great. As an epidemiologist, I don't have to make that decision. So I just generate the evidence, the information that we give to the decision makers who have to take on the risk and benefit for evaluating all different angles and consider the policy. So I can't weigh in on that. My personal opinion is I'm really looking forward to having students on campus in the fall and teaching and working with all of you. And that is my greatest hope right now. So, but that's as far as I will go with that question.
Absolutely, we're all hoping for that. So there's another question. I'm going to direct this to you, Dean Witt. The question is there a graduate program? And there is, so if you'd like to talk about that.
Yes, great question. So we will be launching our graduate and executive education programs in the fall of 2021. And there will be a master's degree in public health, a master's degree in population health, and a PhD program in population health. We also envision a number of graduate certificate programs. So there'll be a suite of certificate programs for working professionals, and then also executive education programs. So we envision developing those programs depending on what working professionals in the field may need. So we are hearing from employers that some of their employees are interested in clinical informatics, so we may develop a graduate program in clinical informatics. So much more to come, but yes, we have a plan in place to launch the graduate programs in fall of 2021.
Wonderful, thank you so much. So I'm going to read out another question, and anyone who wants to take this on. Someone is, if students are interested in going to the medical field, and they're not sure if it's something like being a physician assistant or a physical therapist or something, maybe another clinical field, is there a specific track within the College of Health if those are the students' plans?
Can I take that one?
Of course, thank you.
Sure. So, so there's not a specific track within the College of Health for people interested in a clinical career, but the curriculum is designed to be fully compatible with Lehigh's pre-professional programs, and you have full access to the pre-professional advisors. And so getting all of the requirements that you need for any sort of medical school or dental school is well taken care of, and fits really nicely within not only the timing of our curriculum, but also the scope and the information that you'll be getting through the population health curriculum.
Perfect, thank you. So there's a couple of questions really about kind of logistics. So one question is, what percentage of the professor's time will be spent on research and then what percent in teaching? So is there anyone who wants to take that question?
I'll do that one again too, if you want.
Thank you, Dr. Skinner.
Right, so typically, the typical distribution is about 40% of time teaching, 40% on research, and 20% on service. As we're getting the College of Health off the ground, it's about 100% of time doing everything. So, or at least that's how it feels. But we'll be, there's always some variation in that, but that's the general expectation at Lehigh.
Wonderful.
And it may be that some faculty do more teaching, some do more research. So it could be some variation of that, but Dr. Skinner's absolutely right. That's what is typical.
Wonderful. So speaking of research, it's actually a great question. Are there opportunities for freshmen to become involved in research? And I'll start with that, and others can join in. So I definitely we really focus on research at Lehigh, as Dr. Skinner already mentioned, and we would love to get students into research from the very beginning. So yes, there will absolutely be opportunities for freshmen to be involved. All of the different faculty are doing very different types of research. And so you'll have a chance to get to know us better when you join and see what kind of research we're doing. And we definitely invite you to join us. Is there any other faculty? Or?
Yes, if I could say something, Fatima. I would also echo Fatima in saying that I did very much welcome working with freshman students and on research and in my research looking at politics and policy, and currently in my book I'll be looking for someone to work on looking at the rise and influence of fast food industries around the world and how they're influencing childhood obesity policy in several developing countries. So I'd be welcoming any students that'd be interested in working on a project like that. So yeah, I'm very excited about that possibility. So.
Wonderful. So here's another great question. What kinds of activities would strengthen students' Lehigh experience in their resumes when they go into the job market?
I'll take that one. Yeah, sure. I mean, the obvious thing is everybody's going to have, coming out of an undergraduate education, a list of classes on their transcript and grades that go along with it. What's going to set a student apart in any sort of application process, whether it be for a job or for graduate school, is their experiences. What can you put in your portfolio that you've done? What problems can you point to that you've solved? What papers have you co-authored with a faculty member? What have you done outside of the classroom experience? That's what's going to set somebody apart. And I say that as someone who has evaluated graduate applications and hired people and know that's what I like to see.
Wonderful, very eloquently said. Does anyone else want to add on to that? About maybe things they did during an undergraduate student to strengthen their resume?
Sure, Fatima, I'd like to jump in on that. Dr. Skinner, I completely agree with what he said. But one thing that I did as an undergrad that I think really helped in my future jobs was getting involved in student clubs on focusing on debate, practicing your presentation skills. I was involved in a literary and debating society as an undergrad, and also I tried to get any publication opportunities in newsletters or student journals. So I think those are some things that could help you and set you apart and as your undergrad experience. And there's plenty of opportunity for that here at Lehigh and College of Health as well.
Absolutely.
And if I may add very briefly to my predecessors, it may be that, the next 4 years are meant to be the period of self-discovery. So engaging in activities, projects that speaks to your heart, that reflects your passion and your identity would be a critical step towards discovering who you are.
Very well said. Thank you, Dr. Choi. All right, I will go on to another question. So someone was really interested in learning more about the fall semester core classes and if we could give some descriptions. I'll start. So I'll be teaching the Introduction to Population Health class. So in that class, you will be learning about all the various determinants of health and how they shape health over the life course and how they're all interrelated. And also we'll be learning about how to define and measure health and disease. So those are really the outcomes from the class. I know that we have a few other classes and I'd like the faculty to give a brief shout out to each of their classes. Maybe we'll start with Dr. Choi.
Sure. So in the fall, I'll be teaching global environment and human welfare. It's meant to be a survey course of environmental pollution issues at local, regional, national, and global scale. We'll tackle a number of issues and hone our skills in writing, debating, speaking, so on and so forth.
Wonderful. How about Dr. Gomez?
Yes, I'll be teaching the history of population health in the fall and in the summer as well. And this is a more historical approach to understanding what population health is, how it's been defined in the academic and non-academic community, Then looking at the role of the international community and defining what population health is and working with governments. And then at domestic level, looking at issues of law and public policy and ethics in health systems, human rights issues in population health, and then concluding with some insights into future challenges in population health, such as of course, viruses like what we're experiencing now, and non-communicable diseases such as obesity, environmental impacts on people's health. So that's what the course is. It's an introductory course, so just from a historical perspective on what population health is. But I think students will be interested in not only the history, but also the various policy, institutional, and ethical questions that come out of that course. So.
Wonderful. Thank you, Dr. Gomez. And then Dr. Skinner?
Yeah, so in the fall, I'll be teaching the Population Health Research Ethics course. It's a 1-credit, 5-week, fast-paced course that will get students everything they need to be certified to conduct human subjects research alongside faculty on campus. And we'll also include some of the interesting aspects of philosophy of science and how we know what we know, and what it means to be a scientist working in population health.
Wonderful, thank you. I know we're also going to have a population health data science class. Do you want to talk a little bit about that, Dr. Skinner?
Sure, so we're really excited about the population health data science class. It'll be taught by Dr. Tom McAndrew, who will be joining us in July. This is a one-of-a-kind class that melds the principles of biostatistics that everyone's going to need to analyze and interpret data with modern data science programming techniques. So it'll be, everyone's going to know Python when they get done with our program, and among other things, and we'll have the skills and knowledge they need to take data and work with it and come up with valid conclusions.
Wonderful, thank you. So now I'd like to go around the faculty again. One student has asked, can the faculty members talk a little bit about their research at Lehigh so that students could participate in? And I'll begin with that. So my research really focuses on maternal resilience. So that what are the factors that women can draw upon throughout their life course to help them have positive health, pregnancy and obstetric outcomes. So I'm really interested in measuring what this idea of resilience looks like and how it develops across the life course. So definitely there are a lot of opportunities for research with students there. I'm thinking of doing some large data set research and as well as community-based participatory research. So there are 2 levels of research that we could be working on together. I look forward to that. Thank you. And then I'm going to move on to Dr. Choi.
Sure. So I'm an environmental epidemiologist who focuses on air pollution and a whole series of developmental consequences starting at birth. So I like to look at multiple scales of data, I mean, including genomic, epigenomic, cell level, individual level, regional, neighborhood level data, as well as like much larger scale data, all at the same time to try to map out a causal pathway.
Great. How about Dr. Gomez? Thank you, Dr. Choi.
Yes, my research focuses on global health politics and policy. I started off my career comparing the US and Brazil, then focused on Brazil and then more recently to the BRICS, compared Brazil, Russia, India, China, South Africa. As a political scientist, I look at institutions and the role of institutions and interest groups ranging from special interests and corporate to civil societal actors. And one of my current book projects I'm working on now and doing research on is the rise and influence of junk food industries, Pepsi, Coca-Cola, Nestle, on policies towards children and the poor in emerging economies, Brazil, Mexico, India, China, South Africa. And about halfway, about 3/4 of the way through the book, this will be coming out with Johns Hopkins University Press, and that's sort of the focus of my research right now. So.
Wonderful, thank you, Dr. Gomez. How about Dr. Skinner?
Well, most of my work right now is around developing central research resources for the College of Health and for Lehigh University. So we are planning and starting and continuing our work on a population health data warehouse, getting research-ready data at the fingertips of students and faculty and staff to do great work in data analysis. We are planning for, should I let the cat out of the bag? We're planning for a perinatal birth cohort in the South Bethlehem area, the baby study. So that'll be a great resource for all of us to draw upon for a lot of different hypotheses, following women from before they're pregnant and getting information about their health, following them through pregnancy, birth of their children, and following the children as they develop. We're really excited about that. And since I'm on here, I'm also going to mention we have 3 more faculty members coming this summer. Tom McAndrew, we mentioned before, for the population health data science course. Tom's work is, so right now he's working on modeling COVID transmission on a team that's informing CDC and policy. But in general, his work is around creating ensemble models for predicting seasonal influenza and other viral transmitted diseases in a creative way by asking experts their opinions and then modeling the expert's opinion in the context of the data. It's really cool stuff. And I know he's going to be looking for students to work with him. And then we have Christine and Sean Daly joining us in August, and their work focuses around Native American health and tobacco cessation primarily, and they've got some large studies going on in the American West around Native American health, and there's going to be huge opportunities for students to work in that arena with them, and they're really excited to be coming to Lehigh and joining us for that.
Wonderful, thank you so much, Dr. Skinner. So I have another question here. Someone wanted to know about the level of flexibility for taking courses outside the required core population health courses to explore possible minors and other interests. Do you want to take this, Dean Witt?
Sure. So certainly students will be, able to take courses outside of the College of Health. There will be courses eventually co-listed with other colleges. And there will be opportunities for students to take electives that we will see as contributing to their credits towards their degree. So they can definitely do a minor in another college. In fact, we have one student who's going to be majoring in the College of Health with a minor in business. So I could see the reverse happening where somebody, might be majoring in business and doing a minor in population health or in the College of Health. So yes, that's definitely possible.
Wonderful. So there's actually a related question to minors. Is it possible to minor in the business school, which you've already answered? So yes, it is possible. And what minors might be complementary maybe in the arts and sciences?
Yeah, so we have a wonderful health, medicine, and society program in the College of Arts and Sciences. Which is very focused on more of the humanities and public health side. Population health is really part of public health, but the health, medicine, and society program, I would say, focuses more on public health and thinking about sort of the services and the practice of public health, whereas we're much more focused on the data science. But I could definitely see someone doing both. Because they're interrelated. So that definitely could be an area of collaboration there. And then also for someone who might be very interested in statistics, they might want to minor in mathematics. We also, in the College of Engineering, there's computer science where there's a tremendous amount of innovative work going on around using machine learning and artificial intelligence to analyze data, not necessarily health data, but the same kinds of methods. So definitely there are opportunities in the College of Arts and Sciences and other colleges to minor in some specific areas that would strengthen their experience in the College of Health.
Can I add something to that? I just wanted to say that, as we develop this, these programs, the one thing we heard is that our program allows really a tremendous amount of flexibility in terms of open electives relative to other programs on campus. We have, as many or more open elective spaces in our schedule. So it really comes down to what a student is interested in. They can pursue, just about anything as a minor, depending on their interests.
Wonderful, thank you. So there's actually a great question about one of the seminar courses, which is design thinking. So student wanted to know, what is the design thinking for innovation in health all about? What is that course all about? Do you want to take that, Dr. Skinner?
Sure, I'm happy to do that. So design thinking is an empathy-based design process that was designed at Stanford University, and it's used very widely in industry now. It's something that we encountered quite a bit at IBM, and it really puts you, the designer or problem solver, in the position of thinking about the needs of someone else from their perspective, and not trying to design a solution that you find compelling yourself. This is something that is unique to the College of Health. I mean, you can take design thinking, but it's not required for any other program on campus that I'm aware of. And it provides a toolbox for problem solving that's found to be very effective in the private sector for health innovation and technology.
Wonderful, thank you. So there are a few questions here about class sizes and how many students might we have in the inaugural class, and what might class sizes look like for the core classes. So who would like to take that one on?
I can take on the class size. We have a good solid chunk of students who are coming, and it could be anywhere between a class of 50 to 150. So we'll see, or even more. But at least we think 50 students have confirmed.
Wonderful. And I'd like to step back and really ask a broader question to everyone. Can we each talk a little bit about the types of challenges we might have overcome in our career path and how we overcame those challenges? So I will start with you, Dr. Choi.
For me, the challenges turned out to be I'm sorry for that this might sound cliche, but it turned out to be a great opportunity and a learning experience for me. For instance, I could think of, multiple times when things don't turn out the way I expected, but it had stopped me to and compelled me to think about why, and it compelled me to go deeper. In other words, it really compelled me to go to the foundation of the issue that I was facing, and really try to confront that issue from a different angle. So I actually am incredibly grateful for that opportunity. My mantra for the students is to not be afraid of failures, and just see it as a stepping stone.
Wonderful, thank you, Dr. Choi. Dr. Gomez, would you like to weigh in?
Sure. I guess my biggest challenge was when I left graduate school, going into a field that was brand new. At the time, political science and global health, I knew everyone by first name pretty much. Not everyone, obviously, but I knew it was a very, very small field. And so my biggest challenge was, my first academic job, trying to emphasize the importance of political science and global health. And I did that by, going to conferences, trying to publish as much as possible, working with mentors and colleagues, and trying to organize events and conferences to emphasize the importance of this field. And now, you know, nearly 15 years later, it's a very important field now. A lot of people are doing research on it. I'm happy to say leading the Lancet Commission on the first ever series on political science and global health, and have amazing scholars involved in that special series. And so, but it was a very hard, and still is a hard road in trying to persuade the public health community and medical community on the importance of political science. You know, a field that was often seen as just talking about politics in a very general sense, but not really taken seriously as a methodology. But I think for us in academia, now the political science is a very serious methodology, and we have a lot of methodological theoretical issues that we address. And now you know, the coronavirus has also emphasized the importance of politics and sort of studying that as well. So I think that was my biggest challenge, what I had to do to try and overcome it.
Absolutely. Dr. Skinner?
Sorry, I'm having a little problem with my my microphone there.
Thank you. Well, let me go ahead and answer the question from my end, and then Dr. Skinner will have some time to come back in. So I think one of the challenges I faced is something that everyone faces, is just basically the job market. When you're done with your terminal degree, whatever that is. So when I was done with my PhD, is just really having a very high level of persistence when you're looking for jobs, and really not taking rejection personally. So the idea is you really want to think outside the box and search, you know, in terms of even your search terms. And Dean Witt gave us some great search terms actually to use in population health. And then really being very open to constructive criticism, and really, you know, sharing your job talk and your materials with whoever is willing to look at them, really, to give you feedback, and to keep tailoring them to the jobs, and just to keep being very persistent. And eventually you're going to get a job that's just perfect for you. So that's just one of the obstacles I'm sure many of us have overcome in the past. And then Dr. Skinner, looks like you're back.
Okay, sorry about that. Yeah, it was I got clicking there. So what I found, the challenge for me was the balance between having a skill set in epidemiology that allows you to pursue a really wide range of topics and interests scientifically and intellectually, and focusing those skills onto a topic to follow a thread of inquiry through to some sort of useful conclusion, to take an idea from insight and discovery through to some level of impact, without wanting to jump off to some other new topic that caught my eye. So you know, that's a discipline that we develop over time as scholars, I think. Some people may have it more naturally, but so that's been the challenge. And not to go on, but sometimes the pace of research can be frustratingly slow, and having the patience to work through those slow times and persist with it is another a challenge that I think we've all faced and had to overcome.
Absolutely, thank you. So I think we have time for maybe a couple more questions. But before we answer any more questions, I wanted to let everyone know, or Dr. Dean Witt can let everyone know about our session next week. Do you want to tell us a little bit about that, Dean Witt?
Yes, I'm very excited. We are going to be asking you to watch a documentary called Fed Up. And then we're going to have Hyunok Choi, Dr. Choi, lead the discussion about that documentary and what it means in terms of population health from all angles, thinking about the implications of obesity and the built environment. And so we'll have a series of questions that we'll send you along with a link to the documentary, and look forward to Dr. Choi's discussion with you all about this really interesting and important area of science.
Wonderful, thank you. So let me see, let's look at a few more questions here. There's quite a few. So one great question I thought is asking about study abroad opportunities, which is a great strength of Lehigh. So they wanted to know, are there specific study opportunities specific to population health? And will this be declared in your junior year?
Yes, so we have 2 certificate programs that we'll be offering in the fall, one in population health sciences and the other in global population health, which includes a requirement that, that the students go and have an internship either at an organization in another part of the world or perhaps at the UN here in the United States, but has to have a global health focus. So yes, there are definitely opportunities for students to go to different parts of the world and study population health.
Wonderful, thank you. There seems to be a lot of questions about electives. So one question is, would you have a lot of flexibility with what electives you wanted to take, and how much room is there to take an elective in, I guess, in the program?
Just to reiterate what, or underscore what Dr. Skinner said earlier, there's just a lot of flexibility built into the Bachelor's of Science in Population Health. So students can really tailor the degree to be what they want and work with, you know, their advisors to really think through what are some of the key competencies that they want to learn during their time at Lehigh, and to tailor their education accordingly. So I think that there's a lot of flexibility there, and it may change, you know, over time. People may work with Dr. Choi and realize, oh, I want to go into environmental health, and so their electives in other colleges may look really different than what they originally thought. So I think, you know, based on their experiences with working with the faculty and doing internships, that will certainly direct, you know, what they end up taking.
Wonderful, thank you. I think we'll take one more question, and then I think it's time to wrap up. So will there be a 5-year accelerated master's program? So for example, is there an early acceptance process if a student chooses to continue their master's at Lehigh? And I'm assuming it's a master's in population health. Sorry, go ahead.
That is something that we are discussing, and stay tuned. It's a great question, and one that we're you know, the faculty are definitely considering. So.
Absolutely. So do we want to have some closing thoughts, perhaps from Dean Witt?
Yes. Well, first of all, I want to thank you all for joining us today. I hope this was helpful in thinking about what the career opportunities are once you all finish this degree program. It's a really exciting field, incredibly rewarding. I can't tell you, even in the midst of this pandemic, you know, how many people have reached out, you know, to thank me and many others for the work that we're doing in trying to better understand these pandemics and what are some of the levers that you know, that can be used to try and change the, you know, the course of the disease. So there's just a tremendous amount of impact that can be made in the field. And so I think that that's incredibly gratifying from my perspective. In terms of employment, there's so many different opportunities for employment, literally in every sector. If you wanted to go into consulting, you could go into consulting. You could go and work, you know, in the state government, analyzing, you know, Medicaid data. You could go and work for a nonprofit like the March of Dimes and help them better understand, you know, preconception health and preterm birth. So there are just a tremendous amount of opportunities, and so I would just encourage you to, you know, to think about that in the context of your decision, if you're still weighing your decision, and just know that I think when you graduate from this program, you'll have a lot of experience under your belt. You'll have experience working with faculty, experience perhaps going and working with an organization in another part of the country or another part of the world. And then plus you'll have the foundational curriculum that we'll provide. So I see it as an opportunity for students to really have a leg up when they graduate. I think that they will be very marketable because of this program, because we're really flipping higher education to include experiential learning as a core component of the curriculum. So when you graduate, you will have experience that others will not have, and that will set you apart. So with that, I want to thank everyone for joining us, and I want to thank our esteemed panel once again for their great remarks today. And please stay in touch. And if you have any questions following this webinar, please feel free to reach out to us. We're very eager to engage with you. And we look forward to seeing you next week. Thank you so much.